My mother, thank goodness, she had never had a hysterectomy. But other women that I knew had said, put it off for as long as you can. There was pain, discomfort. It took their 6 months to recover. Some said it was just awful. So I'm like, oh my goodness, I don't know when I'll be ready to attempt that. Once I saw what it was and how fast the recovery, and there wasn't a big surgical procedure, I was sold. They can specialize this surgery now. They can go ahead and take out the ovaries. They could leave the ovaries. They could take out the uterus or leave the uterus. They could pinpoint your particular need. I think that is such a boon for women nowadays. I think it's huge. The recovery time for the Da Vinci method, I had stacked away all the books, all the magazines that I wanted to look through. Never even got to go through them. He gave me some pain management, some pills to take home. I believe I took some the first couple days, and by the third day, I wasn't taking any pain management at all. By the end of the week, I was up, doing things.
I had been feeling real fatigued, lots of cramping, bloating, irregular cycles, and they were getting heavier and heavier. When I went in, he did the blood work and kind of threw some ideas at me. At that visit, we talked about some of the options, ablation, hysterectomy, that type stuff. When the blood work came back, I got the call from his nurse, and she suggested that I come in and talk to him about the hysterectomy. And that's kind of when he started going through all the information as far as what my options were and the type of the robotic surgery. And that was the first time I'd heard of the robotic surgery.
They found out that I had blood clots in my lungs, and they ran a whole bunch of tests on me. And one of the tests came back, it was the CA-125. It came up at an elevated level. So they had me go see a gynecologist, and I had already had an appointment to see him for about 2 months out, but I needed to get in quickly, so they scheduled me in as quick as they could. In fact, the next day, the second day that I called, they scheduled me in. And I went and then had to do an ultrasound, and after I had done the ultrasound, they told me that I had a huge fibroid tumor that would need to be removed. My expectations were probably out 6 weeks. I have 2 older sisters that have both had hysterectomies, and they had them a long time ago, and they were both out for 6 weeks. So I thought, okay, 6 weeks, a month, that should be, I think that would probably be a good estimate of time. I had the surgery. The pain was minimal. I could have probably come back after a week. I came back after 2 weeks. I came back to work after 2 weeks. I was so glad to meet Dr. Glass. He's been great. He's very informative. He answered all my questions and concerns, and he made me feel very comfortable about it.
Robotics enables a surgeon to do some very, very intricate and precise surgery through very tiny incisions. The effects are obvious for both the patient and the physician. The patient has the opportunity to have significant surgery done with very little pain postoperatively. The physician has the opportunity to do very precise work in a sitting position as opposed to standing at the operating table. I spend a great deal of time going over the surgery that they're going to have. The best part is they know that I'm very comfortable with the procedure, that I tout the procedure, that I do the procedure, and then I teach other surgeons to do the procedure. So I think they're pretty excited about that. Oftentimes these patients go home the same day as opposed to 2 or 3 days in the hospital and 6 to 8 weeks recovery. And we've had a lot of patients go back to work even before the 2 weeks that we usually tell them when they go home.
I would absolutely suggest it, definitely. I think that the pain is minimal, your recovery time is a lot faster.
I feel like a new person, so I would hate for somebody to go through what I went through for so long and to not have it, knowing the option that's available, and and how easy it is and was, and how good a care they took of me.
If I had known this was going to make me feel so good so fast, I would have had it 2 or 3 years before.